Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, and I would like to officially welcome you to episode 54 of the Ask Dr. Angela podcast. I can barely get that out. The Ask Dr. Angela podcast. As you can see, I am still dealing with not much of a voice, but you know what? That doesn't stop this show because we're just doing it, and we're going to keep doing it. So here we go. We're going to jump right into today's question so that I can try to get through this and be able to say what I need to say. So here we go. I commonly get asked what to do with lightheadedness, occasional dizziness, specifically when it occurs during pregnancy. I tell my pregnant patients all the time, as beautiful as pregnancy is, sometimes it just sucks. I mean, you're already feeling big, bloated, back pain, nausea, and now you occasionally deal with being lightheaded and dizziness. So here we go. One of the biggest pieces of advice that I give to my pregnant moms is make sure that you move in slow motion. Exaggerate your movements. Don't stand up too fast. Don't roll over too fast. Don't get out of bed too fast. Don't turn around too fast. Doing things too quickly certainly can cause common symptoms of lightheadedness, dizziness, and occasionally shortness of breath. The other thing that I commonly recommend is making sure that you are hydrating. Being dehydrated can cause these same symptoms. Making sure that your blood sugar doesn't drop too low is also really important. Small, frequent snacks are a must. Hypoglycemia is another very common cause of the aforementioned symptoms. So in a nutshell, staying hydrated, small, frequent snacks to ensure that your blood sugar doesn't drop too low, and slowing things down. Don't stand up too fast. Don't turn around too fast. Don't roll over too fast. These are common pointers that can help to alleviate symptoms of dizziness, lightheadedness, and occasionally shortness of breath. If, however, these symptoms persist, are occurring more often than not, or just don't seem to be going away, I would strongly encourage you to touch base with your OBGYN right away, as it might be something else more significant going on. Thank you so much for tuning in. Hopefully, number one, you understood what I was saying. This no voice thing is killing me. And number two, that you got something out of it. If you have a question or a topic that you would like addressed, please go to askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. In closing, I'd like to leave you this. Rupert Murdoch said, results go to the bold. So I'm challenging you to go out there and go for it. Do something worth remembering. Until next time, look better, feel better. I'm certainly working on that part. Be better.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listen Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.